We wanted this to be a um, very informative part program that you understand the ins and outs of diabetes, the good, the bad, the ugly. I feel like we do a pretty good job of sharing that if you have type 2 diabetes, it's not an excuse to not still maintain your diet and exercise. It's still very important that you do those things. And in this presentation, we kind of go through what life would be like if you were a type 2 diabetic, um, how it develops and its symptoms and how it's diagnosed. And if you were to have it, what kind of care plan, what your care plan may look like, and then long-term complications associated with the disease. So what are the symptoms of type 2 diabetes? Well, for one, according to the Center for Disease Control, there are 28 million people in the United States diagnosed with diabetes, and that was from 2021. So that number could increase from 3 years ago. So we don't have that data yet, and hopefully I would like to hope that it's it hasn't grown, but unfortunately it probably has. But the symptoms can be mild to severe. And the problem with type 2 diabetes is a lot of times when you're diagnosed, you've had it for quite some time. And usually, many times, the only reason why you get diagnosed is because you're starting to have major complications with your health. So that's the unfortunate. It can go undetected for years, and even by your doctor. Doctors won't detect it for a year. So that's why we talk about it. And some of the things that you really need to be cautious of. And when I talk about these pieces, it's very noticeable. I know you're not that old, Diego, but as you age, some of these things happen as you age.
Yeah, that's how my dad found out.
Yeah.
Urination.
Yeah. But it's extreme. It's not like, when you get older, you wake up in the middle of the night and you have to go to the bathroom. No, you're going to the bathroom quite frequently. And the same with your thirst. Your thirst is not normal thirst. Every once in a while you eat something that makes you a little more thirsty than normal. But this is very, very noticeable. These symptoms are increased hunger, your fatigue. It's very much noticeable. Increased urination, especially at night. Sometimes it's weight loss, like severe weight loss, blurred vision, and sores that do not heal. So for people with type 2 diabetes, symptoms generally develop gradually, and many people do not find out that they have type 2 diabetes until they develop a complication from the disease, as I said before. And that's why we talk about vision in the fourth presentation. I think it's the fourth one, second or fourth, I can't remember. But we talk about that because that is one of the areas that it does seem to attack quite frequently, is your vision. And it can produce heart trouble. And you can have it for many years before you're even diagnosed. So in order to describe diabetes, it's important that you understand how the body processes and uses food. So each time we eat food, our bodies go through the process of changing the food into energy that our energy can use for daily activity. So the food we eat is broken down by our bodies into what we call glucose. Glucose is what fuels the cells of the body, and these cells need energy from glucose to live. Glucose from the food is carried by the blood to the cells throughout the body. Glucose, however, is not automatically absorbed by your cells. Okay, so insulin is required to unlock the cells and allow the glucose to be changed into energy. If there is not enough insulin, or if the body does not use insulin properly, which is where you're hearing more about insulin resistance, then the glucose is not able to get into the cells. As a result, glucose builds up in the bloodstream and causing high blood sugar. And there is no cure for diabetes. But that doesn't mean you don't properly manage the disease through a lifestyle change and medication. So when diabetes is not controlled, your glucose builds up in the blood and can cause damage to vital organs. When diabetes is controlled, complications can often be avoided. And then they do a little picture over here. This is the insulin resistance. It kind of doesn't produce it well, doesn't handle it well. So there are two different types of diabetes. There's type 1 diabetic, and then there's a type 2. So the type 1 diabetic has no insulin whatsoever. And I don't want to say they're born with it, but it's almost as there's just not enough in their body, even as a child, to process down that glucose and move it into the cells for energy. Type 1 diabetes typically happens to people under the age of 30 and cannot be prevented. So it's something that you're possibly born with, and it's usually detected at an early age. It's not later on in life. It's normally detected under the age of 30. Now, in type 2 diabetes, a person's body does not use insulin effectively, and over time will not make enough insulin. But type 2 diabetes can be prevented, which is what this program is going into. So how do they test for diabetes? It should be done by your healthcare provider, and there are currently 3 tests that can be done. One is the fasting plasma glucose. This test measures the impaired fasting glucose. A person's blood glucose is measured first thing in the morning, following an 8-hour fast. So your normal blood glucose levels would be below 100 milligrams per deciliter. Prediabetes would be between 100 and 125 milligrams per deciliter, and diabetes would be 126 milligrams per deciliter or above. So the other test is the oral glucose tolerance test. This test measures the impaired glucose tolerance. A person's blood glucose is measured after an 8-hour fast, and then again 2 hours after drinking a glucose-rich solution. The levels measured 2 hours after drinking the solution should show, like normal would be below 140 milligrams per deciliter. Prediabetes would be 140 to 199 milligrams per deciliter, and diabetes would be 200 milligrams per deciliter.
That's just like what we do.
And the other common test is the HbA1c that I think a lot of us have heard. This blood test measures the person's average glucose levels over an 8 to 12 week period before the test is given. Blood is drawn from a person's arm or finger, and fasting is not necessary. So normal A1C would be below 5.7%. Prediabetes would be in between 5.7 and 6.4%, and diabetic would be 6.5%. And in this program, we want to see you move that number by a 0.5%. So what would your medical care be like? So if you are diagnosed with diabetes, you and your doctor will work out a diabetes care plan and build a team of healthcare providers to give you the care and information that you will need to safely and effectively manage the disease. Your first visit with your primary care physician would include a physical exam, your medical history, and blood and urine tests, and then follow-up visits to your physician should happen regularly. So once this is done, this should happen more regularly. Many times, it's not always, your primary care may or may not have you go to a registered dietitian. Sometimes you have to ask for that. So don't expect, like if you want to see a registered dietitian, and your doctor doesn't say anything to you, that's something you need to ask about. It would be important for you to meet with a registered dietitian who is trained in diabetes management. So make sure that registered dietitian is trained in diabetes management. The dietitian would teach you how different foods affect your blood glucose levels and get you started on a healthy eating plan if you aren't already maintaining those practices. And they might have you go to a diabetes educator, which that's kind of what this program is, to be honest with you. A diabetes educator is trained to help people with diabetes learn to self-manage their disease. A diabetes educator can be a nurse, a dietitian, a pharmacist, or other healthcare providers. Your doctor would give you a referral for a diabetes education visit. And the other one would be a specialist that everybody should be doing is doing an annual physical exam. But when you go to your annual physical exam, like, I don't know if you have a primary care physician, but if you don't, make sure you get one. And then I would set up, it's not an abnormal thing to request an annual physical, that's what you would call it. And then make sure that they know that you would like to be tested for prediabetes, because it does run in your family.
Okay.
And then don't be afraid, though, too. Share as much information with them, Diego, as you can. Don't ever be afraid to share that, because the more they know, the better they can serve you as well. You can even tell them that you're in a program and you are learning a lot about it. And I am starting to really take my health seriously, but I just want to make sure that I'm okay. And chances are what they would do is they would probably do the A1C test on you. I'm not saying positively that's what they would do, but that's kind of the normal procedure now, is doing the A1C test, because there's no fasting involved, and it just is a little bit easier on people to do it that way. But that doesn't mean that's the only way they're going to do it. But I would definitely go to your primary care, tell them, you should get a annual physical anyways, just to make sure that you're, on the healthy side, just like getting an eye exam. I kind of look at it like I have to get an eye exam every year. You should be getting a physical every year anyways, just to make sure that your cholesterol's good, your blood pressure's good, and all those fun things. And they should test you for all that anyways.
Got it.
The only question I had was about the diabetes testing, and I was asking, was the one test, I can't remember what it was called, but that's like when we get tested for gestational diabetes while pregnant, when you have to drink the liquid. Is that the same thing?
I think it is.
Okay.
Yeah, I think it is. Because I remember having to do that. And I remember it was like, nasty.
Yeah.
But I'm pretty sure it's the same thing. Yeah.
Okay. Thank you.
And you know that if you have gestational diabetes, you're more prone to becoming a type 2 diabetic. I don't know if you know that. I didn't hear you. I'm sorry.
No, I said that makes sense.
Yeah. So that is one of the things that early on in the program we talked about that. So if you've had gestational diabetes while you were pregnant, chances are you're at greater risk to develop type 2 diabetes. So that's why it's even more important for you to make sure you're getting your tests, your pre-diabetes tests, just to make sure you're in check. And I don't know where to go with the presentation where I stopped being heard. So
no, we could hear you the whole time. You just couldn't hear us. We heard you.
Oh, okay, good.
So you're good.
Okay. All right. Good. So I don't need to go backwards. Cool. Okay. And then, like the specialist, diabetes can cause problems with blood vessels and nerves, which is where we talked about, like your eyes. That's why your eyes are so vulnerable, because they have some of the smallest blood vessels are in your eyes. So that's why that tends to be the area that it'll attack. But that's not the only area. So it can lead to problems with blood flow to your heart, your eyes, your kidneys, your legs, and other organs as well. And if you are having those types of problems, your primary care physician may have you go to a specialist to help with that. So the cornerstone of diabetes care is managing your daily lifestyle. So to reduce the complications related to diabetes, you would try to maintain proper blood glucose levels, blood pressure levels, and your lipid levels. And if you're on medication, take them as prescribed. Do not self-medicate. And hopefully you develop a nutrition and physical activity plan as well. And like I said earlier, that's kind of what this program is. We're kind of that diabetes education program that's kind of gearing you towards making this a lifestyle change. How would your life change at home? To test your blood glucose levels on a regular basis as determined by your physician. And your doctor would give you a target range for you for your blood glucose levels and tell you how often to test. So some people only have to test once a day, some twice, some 3. It just depends on where your levels are when you are diagnosed. And over time, if you get it under control, that can change as well. You might start out having to test your blood sugar levels quite frequently, and then you might be able to back down as you reduce your as it becomes better managed. And that's why we don't, we're not telling you guys that, once you have type 2 diabetes, it's not you have it, but you can get it under control and not and maintain it at a certain level, like put it in maintenance mode, I guess is what I kind of look at it as. Physical activity. It is recommended that people with diabetes get at least 30 minutes of physical activity 5 days a week. Physical activity helps maintain proper glucose levels. It also helps with weight loss or maintenance and contributes to a healthy heart. It gets your blood flowing, which is what you need to move your glucose through. And if you are in a sedentary life, you want to make sure you talk to your physician before you get physically active. I highly doubt that any doctor would tell you, no, I do not want you doing any physical activity unless you are completely incapable of doing that. Most doctors are going to, if you're diagnosed, they're going to tell you you need to start getting in some kind of physical activity. Medication. People with diabetes may need to take medication and or insulin to help control your blood glucose levels. Again, going back to that's what you and your doctor would talk about and how frequently you would need to do that. And please make sure you follow the proper. If your doctor tells you you need to take your medicine morning, noon, and night, you take it morning, noon, and night. You don't say, oh, I'll just take it now and I'll just take it this time and whenever I feel like it. That's not proper management. So there are two symptoms to high and low blood glucose levels. Some of you may have heard this and some of you may have not. There is hyperglycemia. That is the high blood glucose. Hyperglycemia is when your blood glucose levels are too high and your body is not using its insulin properly. High blood sugar levels can lead to the development of long-term complications. And hypoglycemia, or low blood glucose, is when blood glucose levels fall below the normal range. And some of the symptoms of hypoglycemia include dizziness, headache, shaking, and irritability. So just remember, there are two different kinds of blood glucose. There's high and there's low. Hyper, you think about it, someone that's hyper, it's higher, and then hypo is the lower blood glucose levels. There are long-term complications related to uncontrolled diabetes, such as heart disease and stroke. And the reason why is your blood vessel problems are related to uncontrolled diabetes. This can lead to heart disease and stroke. And to lower your risks of complications from diabetes, remember the ABCSs. So A is your A1C, which is the measuring of your blood glucose levels. B is your blood pressure. C is your cholesterol, and S is your smoking. If you're a smoker, please try to stop smoking. Long-term complications can be kidney disease. It can lead to kidney disease. Problems arise when the kidneys have to work extra hard to filter the excess glucose in the blood. And over time, this damage can lead to kidney failure, which is a serious and life-threatening problem. It can lead to foot complications, and that again is because the blood vessels affect the flow of blood to your feet and legs. And nerve problems can affect sensation in the feet. Good blood glucose control and proper foot care can prevent problems leading to ulcers, circulation, and nerve problems and amputation. Eye complications. People with diabetes are at higher risk of developing retinal eye problems, which are complications that include glaucoma, damage to the optic nerve, and cataracts, which is the cloudy area of the lens, and retinopathy in general terms for disorder of the retina.